Nurses at a New York hospital want the entire maternity ward to be moved following the discovery of elevated mold levels and traces of anesthetic gases found in the unit, which staffers believe are making them sick. The nurses told the New York Daily News that 53 people working at Staten Island University Hospital North in Staten Island, New York, have reported experiencing headaches, dizziness, swollen throats and other symptoms in the past few months. Their symptoms, apparently, started manifesting after air quality monitoring devices detected mold and trace amounts of anesthetic gases in the hospital's maternity unit. Maternity ward staffers first noted a strange chemical smell in the nursery in September, with 8 staffers then reporting really bad headaches and getting dizzy, lightheaded, per diem nurse Robyn Jacobs, 65, told the newspaper. Jacobs said that she herself has gotten sick each of the 6 times that she has been in the maternity ward, with her complaints including headaches, losing her voice and chest tightness that feels like an allergic reaction. After the initial chemical smell was reported, babies were moved to a backup nursery unit at the hospital. Meanwhile, the hospital began testing the air quality, finding moderately elevated levels of mold, hospital authorities told the Daily News. Workers then located and decontaminated waterborne mold found behind a sink wall. But mold isn't the only thing that the nurses are worrying about. Share this article. Share. Recently, ongoing air testing in December revealed the presence of sevoflurane and nitrous oxide, anesthetic gases which are routinely used during surgical procedures, the hospital said in a statement to the newspaper. The gas levels found were said to be significantly below the National Institute for Occupational Safety and Health's recommended exposure limit and were not a danger to anybody in the hospital. Specialists were also brought in to determine if there were any leaks in the hospital's gas system infrastructure but could not find any leaks. The hospital maintains that the air is safe to breathe and it is currently working on rebuilding the original nursery. Nurses said that the smell has been coming and going since the original report was made, but that people are still experiencing the same symptoms. Despite the hospital's claims about air safety and the fact that there don't appear to be any reported symptoms in any of their patients, nurses are concerned that babies still could be at risk. As for the nurses' demands that the entire maternity ward be moved somewhere else, Ardalic said that there was no reason to make such a drastic move when nearly 30 tests have revealed that there are no risks to be had in the ward's current location. Ardalic said he understood where the fear and concern comes from, but at the same time, we can't move patients into floor and take those types of risks without having some justification for doing that. The unit is safe for people to be in, the unit is safe for moms, the unit is safe for children, Ardalic told the newspaper. There really isn't any more testing that we can do at this point. They keep telling us it's safe, it's safe, it's safe, Jacobs said. How safe is it? Because we're all getting sick. DailyMail.com has reached out to the hospital for a comment.